In the latest fight against the pandemic, health officials are now preparing to roll out the COVID-19 booster shots for those who are eligible. 11 Alive's medical correspondent, Dr. Sujatha Reddy, shares what you need to know in today's Good Health. Dr. Reddy, first and foremost, explain how the booster shot actually works.
So the booster shot works just like the previous two vaccines people may have gotten. It makes the immune system generate antibodies against the coronavirus. These antibodies will find the virus, attack it, remove it before it has a chance to make you very, very sick. So the booster shot works just like the previous two vaccines people will have received. What's happening is we're finding that the antibody levels seem to drop over time, about 7 to 8 months after you've received that second vaccine. This booster shot keeps your antibody levels high enough to fight the virus very, very well.
Okay, so then when should we get it and how long is it going to last?
Yeah, those are great questions. So it's currently recommended that you get that third booster shot 8 months after you received your second dose of either Pfizer or Moderna, the mRNA vaccines. And how long is this one going to last? That's a great question. I'd have to look into a crystal ball to answer that.
Right.
But hopefully it will last months and months. We're just going to have to see. But I think it's, not unreasonable that our first vaccines have lasted about 8 months. I think that's actually quite good.
Yes. All right. Now, here's a question for you. Is it important for that third shot or booster to match the original vaccine? Can you mix and match?
Yeah, great question. So far, all the data we have is on sticking to the one you received. So Pfizer people should get a Pfizer booster. Moderna people should get a Moderna booster. That's the best advice we have right now. And there should be plenty of vaccine available, so it shouldn't be difficult for people when these are available to get the one that you previously received.
Okay, you mentioned the two, but what about the one dose Johnson & Johnson? Would you recommend that people who have that get the booster?
So right now there isn't enough data on Johnson & Johnson because if you remember in the spring, that one actually started being given to people a little bit later.
Right.
So those people are still in that early window. Data is still being collected. But my gut instinct is that down the road, yes, Johnson & Johnson recipients will need a booster more than likely as well, but we just don't know yet.
And for a lot of people who were hesitant to get the vaccine, the FDA approval of Pfizer's COVID-19 vaccine kind of put their mind at ease, really allayed some fears. Does the FDA also, does that include the booster shot as well at this point?
Yeah, it does not yet. So we don't have an official approval from the FDA for the booster, but I believe that is coming very, very soon. And it's after that that the third shot will be available. I should say that the booster right now is recommended and being given to people in that specific category that we call the immunocompromised people. So people with weakened immune systems, they already have received or are getting that third booster. But for the rest of us, we have to wait for that 8-month mark, which is actually right about now for people who received it in December, which would be mostly healthcare providers. So for those people, right now is about the time. And I think FDA approval for that booster is coming soon.
I feel like side effects kind of ran the gamut. I just was sleepy, sore arms. Some people had more severe side effects. What are you seeing or hearing about in terms of the booster?
The same kind of thing. I think it's going to run the gamut. I think it may depend on how you reacted. It may be less, it may be more. Again, I think the point is, get that booster when it's available to help protect us from, coronavirus cases and illness.
Sure. And is it safe for pregnant women?
There's no specific recommendation for pregnant women. They weren't excluded, but I think it's an important point to say that the CDC, the American Congress of Obstetrician Gynecologists, are all recommending that pregnant women get vaccinated. We have data now over these last 8 to 9 months of women who were pregnant who got the shot, women who got pregnant after getting the shots. So it is recommended for pregnant women. For the booster, I think that's going to be the same. They haven't made a a special category for them yet.
Okay, and this might also be a crystal ball question, but how likely is it that we're going to need a fourth dose after this booster shot?
Yeah, I think that's just going to depend. You know, it's going to depend on how all of our bodies respond to this third booster. If we get a high enough level of antibodies, we may not need another one, or we may not need it for quite some time. It just depends on how well these vaccines make our immune system make antibodies to the coronavirus and how long those antibodies last. Variants are also going to be another sort of wrench in there to see what's going to happen with that. So it's, again, you're right. That is a crystal ball question.
Well, doctor, thank you so much. This is top of mind for so many of us. So thank you for clearing up a lot of this information for us. We appreciate it. Oh, thank you so much, Dr. Reddy. And for more information about COVID-19 right here in Georgia, head to 11alive.com or just make sure you download our 11 Alive app.